On the previous pages, we looked at an example of the different stages of a scientific investigation: asking a question, conducting background research, constructing a hypothesis, testing the hypothesis, analyzing data, and drawing conclusions and communicating results. We're going to look at a historical example which illustrates each of these different stages by going back to the mid-19th century and the Soho district of London during what was called the Broad Street cholera outbreak. Cholera is a bacterial infection caused by drinking contaminated water or eating food that has been in contact with contaminated water. It can cause diarrhea and vomiting, and without treatment can cause a person to quickly become dehydrated and go into shock. In the most severe cases, the condition can be fatal. Between 1831 and 1854, there was a severe outbreak of cholera in Britain's industrial cities, and a key question for scientists and public health officials was how the disease was spread. At the time, cholera was believed to be spread by miasma, bad air rising from decayed organic matter. However, the surgeon and anesthesiologist Dr. Snow had recently published a pamphlet on the mode of the communication of cholera that argued that cholera was spread through contaminated water. At this stage, the hypothesis was based on anecdotal evidence and the statistics shown in the table to the right, providing an overview of the location and number of cholera deaths, attempted to link this to drinking water from more polluted areas of the Thames River. In late August of 1854, Soho in London was particularly badly hit by the disease, when what Dr. Snow described as the most terrible outbreak of cholera which ever occurred in the kingdom broke out, and 127 people living in and around Broad Street died over a period of only 3 days. By the 10th of September, 500 people had died, and Dr. Snow was convinced that the outbreak was caused by sewage-tainted water supplied by the Vauxhall Water Company. He set about testing this hypothesis by interviewing families of the victims in Soho and tracking down information from hospital and public records, identifying the source of the outbreak as the water pump on Broad Street. He plotted cases of cholera on a map, using dots to illustrate the cluster of cholera cases around the pump, and used statistics to demonstrate the connection between the quality of the water source and cholera cases. He also explained the case of key anomalies, the individuals in the area that did not get sick. This included a group of workers in a brewery 1 block east from the pump that only drank beer with water from the brewery's own spring. Dr. Snow was able to use his studies to persuade the remove the handle of the Broad Street pump, which is credited to helping end the outbreak, although Snow himself identified that the epidemic may have already been in rapid decline by that stage. Dr. Snow communicated his results to the medical community and wider public, although public officials were not convinced of his hypothesis, and it took many years before public officials made necessary improvements to repair sewers and drains. Sadly, Dr. Snow died before it was widely recognised that cholera was spread by contaminated drinking water. However, he is recognised as an important figure of the history of epidemiology, and the basic principles established by Snow still exist in current epidemiological thinking. This video was produced with information from the following sources, which you can find in the bibliography of this module.